Well, with flu season heating up, the CDC urging parents to vaccinate their children. But which is a better bet, the flu shot or the FluMist nasal spray vaccine? The Fox Medical Team's Beth Galvin has some answers.
The FluMist nasal spray is back in doctors' offices this year after the CDC stopped recommending it for 2 years because of concerns about its effectiveness. So as a parent, which should you choose, the shot or the spray? The country's largest pediatricians group, the American Academy of Pediatrics, recommends kids 6 months and older get a flu shot rather than the nasal spray vaccine, saying the shot offers the most consistent protection. And Atlanta pediatrician and WebMD medical editor Dr. Hansa Bhargava agrees.
I usually do the flu shot, and I think it's quick, it's easy.
For kids 2 and older, the FluMist nasal spray vaccine is available again this year after disappearing for a couple of flu seasons. But the AAP recommends it as a backup to the shot for kids afraid of needles or a doctor who runs out of injectable vaccine.
I think that some parents feel like that's an easy way to get the flu vaccine, and if it's the right candidate, I would certainly let them have it.
But Dr. Bhargava says the nasal spray vaccine is a live vaccine, so it's not a good fit for anyone with an underlying health problem.
Typically, it has to be a healthy person between the ages of 2 and 49. If there's any risk of disease, especially diseases that can have respiratory symptoms or can make a child sick, it's probably not best to get that and get the injection.
In the 2017-18 flu season, 179 children died of flu-related complications, and many more ended up in the hospital. The Centers for Disease Control and Prevention here in Atlanta says about 80% of the children who died were not vaccinated against the flu. And remember, kids between 6 months and 8 years who have not been vaccinated before or have had only 1 dose in an earlier flu season will need 2 doses given about a month apart.
But I think that parents should be aware that the flu shot is pretty mild in general, that it takes only a few seconds, and that usually there's very little reaction to it.
Children 9 and older need only 1 dose of the flu vaccine, regardless of their vaccination history. And the AAP says children with egg allergy can get a flu shot with no additional precautions than those used with other vaccines. And the group is also urging pregnant women and healthcare workers to get vaccinated. For the Fox Medical Team, I'm Beth Galvin.